As defined by Always Culture, a recent study from Johns Hopkins suggests that medical errors are now the third leading cause of death in the U.S. This has now surpassed strokes, Alzheimer's, and diabetes. And as stated by Patient Provider Interactions, the Joint Commission on the Accreditation of Healthcare Organizations indicate that 80% of medical errors are due to communication breakdown. So just to clarify, some of the most common types of medical errors include medication errors, errors related to anesthesia, hospital-acquired infections, missed or delayed diagnosis, avoidable delay in treatment, inadequate follow-up after treatment, inadequate monitoring after a procedure, failure to act on test results, failure to take proper precautions, and technical medical errors. So the goal of this skills workshop is to encourage providers and physicians to take action and take action to help prevent these medical errors from occurring. So, for example, something that can be done to prevent a medical error is to double check the medication itself, that it is going to the correct patient or the correct individual. Verify that the medication is the correct dose that is being given to the patient. Just take those extra precautions. For example, when I do clinical, we are assigned a patient and we are given the medications that are supposed to be given to them. And before we give the medication to the patients, we go into their room, we look at their bracelet, and we scan it. But not only do we scan it, we also ask the patient, okay, what's your name and your date of birth? And then we verify. So that is one way right there that can prevent medication errors. And in the hospital setting, that is one of the most common ways that medications are being verified that they are being given to the correct patient. It is important that not just their room number is verified, because a patient can be switched from room to room. It is also important that it's not their telephone number that is being verified, as it could be maybe their spouse's telephone number or a friend's telephone number and not actually their telephone number. And so it's very important that these extra precautions are being taken. So that is just one example of how medication error can be prevented. So also, coming from Always Culture, studying these mistakes and learning how to prevent, monitor, and respond to them is key to changing the standards of care. So even if a medication error even if a medical error is to occur and therefore it was not prevented, it is important that once it occurs, the providers know how to go about going about taking care of these errors once they do occur. And for example, if a medication is given at the wrong time or given to the wrong patient, it is important that the provider knows the protocol and what they need to do once that error occurs. So say the wrong dose was given to the wrong patient and the patient is not having any side effects or any problems, it is important that the patient is then being monitored and that this error is also documented in the patient's chart.